Hey everybody, welcome back to our DOCSHAALA. So in this video, we are going to see about osteomalacia from the subject oral medicine and pathology. So a question was asked in the previous exam. So let's just dive into the topic now. So what is osteomalacia? So it is nothing but a metabolic bone disorder which is characterized by impaired mineralization of the bone matrix. So impaired mineralization of bone matrix result in osteomalacia. So bone creation, how does bone creation occur? It is by deposition of hydroxyapatite crystals on the bone matrix. That is osteoid bone matrix takes place. Then only bone deposition occurs when there is a problem in this deposition of hydroxyapatite crystals. Then there is impaired mineralization of the bone that results in bone softening. The bone becomes soft. So that is when this osteomalacia occurs. So it may result in adults due to prolonged vitamin D deficiency. So this results in abnormal osteoid mineralization. Okay. So let's just see the causes. So as we have seen, decreased vitamin D production, decreased vitamin D absorption, altered vitamin D metabolism, hypophosphatemia or hypocalcemia, medications like causing anti-hypocalcemia fungals, and steroids can also lead to osteomalacia. So the main culprit here is vitamin D. Either decreased production or decreased absorption or any altered metabolism of vitamin D leads to osteomalacia. Apart from this, hypophosphatemia and hypocalcemia, and also certain medications such as anti-hypocalcemic fungals and also steroid sometimes causes osteomalacia. Okay. And coming to the signs and symptoms. So the signs and symptoms, as we know that the bone mineralization is affected, the bone becomes soft. So when the bone is becoming soft, there is increased fracture tendency in the individual, right? So when evaluating what we have to take patient's family and also surgical history. Okay, so like activity level, hobbies, diet, everything should also be seen. Then the main symptoms of which are non-specific but may include proximal muscle weakness and wasting, myalgias and arthralgias, muscle spasms, altered or waddling gait. The gait is waddling. That is, it is not having sufficient strength, right? So sometimes the patient may waddle like this. Okay. Spinal, limb, and pelvic deformities are seen. Aching bone pain aggravated by activity and weight bearing, increased falls. So when he is not able to walk properly, what happens? The patient falls frequently. Okay. Then hypocalcemic seizures or even tetany is also seen. Then how do you evaluate? So definite findings or possible findings of osteomalacia were proposed by Fukumoto et al. Okay. So which requires validation with further studies. So what they have proposed is hypophosphatemia or hypocalcemia, high bone alkaline phosphatase, muscle weakness or bone pain, less than 80% of BMD, that is bone mass density of the young adult men, and multiple uptake zones by bone scintigraphy or radiographic evidence of looser zones, that is pseudo fractures. So when the patient is having all the five factors, his probably definite osteomalacia is present. Definitely the patient is suffering from osteomalacia. But if he is not having all the five, but having first and second factors, and 2 out of 3 through the 5 findings are considered as osteomalacia. First and second factors are important, like hypophosphatemia or hypocalcemia should be there, and high alkaline bone phosphate should also be present. And the last 3 factors can be any two of which, any two, if it is there in the patient, then the patient qualifies for osteomalacia. Okay. Then the serum level of 25 OHD is currently regarded as the best marker for vitamin D status. So usually when it is severely low, that is less than 10, then in patients with nutritional osteomalacia. So other sensitive biomarkers include increased serum parathyroid hormone and decreased urinary calcium. So 25 OHD indicates vitamin D levels. So if it is less than 10, then it is considered as nutritional osteomalacia. Other sensitive biomarkers include increased serum parathyroid hormone PTH and also decreased urinary calcium. So this is a X-ray depicting the pseudo fracture of the bone. Okay. So radiographic findings, as we already know, looser zones or pseudo fractures are seen. So this is the classical finding. So they may represent poorly repaired insufficiency fractures and are visible as transverse translucencies. Okay. Then typically occur bilaterally and symmetrical at the femoral necks, shafts, pubic and ischial rami. These are the places we can see the pseudo fractures. Okay. Then coming to the treatment should be focused on underlying disorder and subsequent correction of vitamin D and electrolyte deficiencies. Then the question that was asked in NEET MDS 2022 was, osteomalacia is characterized by, is it defective osteoid and normal mineralization? Is it normal osteoid and normal mineralization? Is it normal osteoid and defective mineralization? Is it defective osteoid and defective mineralization? So one thing we have to keep in mind, in osteomalacia, there is only defective mineralization. Okay. The osteoid, that is the main part that is forming the bone, is normal. There is no problem with the osteoid. There is only problem with mineralization. Okay. So the answer for this question will be normal osteoid and defective mineralization. Okay. So if you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram at DOCSHAALA for dental content and at DOCSHAALA medical for medical content. You can also follow us on our Telegram handles. Thank you.